Let's just jump right into it and talk about the market that is out there to serve and grow survivorship. Well, to start with, I guess I should say, I'm Andrea Leonard. I am the president and founder of the Cancer Exercise Training Institute, and I'm a 36-year cancer survivor. I started writing books on cancer and exercise in 1995 and was fortunate enough to work with the chiefs of breast surgery at Johns Hopkins, GW, and Georgetown University hospitals. And I was inspired by my mother, who at the time had been diagnosed with her second breast cancer and asked me for help in her recovery. And then in 2004, realizing that, the need was even greater, I created the Cancer Exercise Training Institute, knowing that I could only train so many people a week and wanting to create an army of sorts of cancer exercise specialists who'd be able to reach out and help people all around the world. And so over the last 2 decades, we've got cancer exercise specialists trained in 35 countries. And Frank McKenna, who chit-chatting here with, is one of our fabulous cancer exercise specialists and an amazing survivor himself. So I'd love to hear, even though I may have to look at it afterwards, what your reason for being here today is, guys. What made you choose this? Have you had cancer? Have you been affected, by somebody in your life, a loved one? And I want to be able to address any of your questions or concerns and leave you feeling that you gained something from this webinar. So there is a huge market, and Dan Ritchie and I talked about this, the overlap of the aging market, the baby boomers, and then the percentage of them that potentially are going to get cancer. And in 2018, we're going to be updating these numbers shortly, but unfortunately they're always like a year or two behind before they put them out. We had about 18 million cancer cases around the world. Okay, so those are newly diagnosed cancer cases. But then in that same year, there were 43.8 million people living with cancer. So 43 million people that need somebody to help them through their treatment into recovery and long-term survivorship, and most of whom don't know where to turn. Their doctors aren't referring them to PT, or they, go to a gym and they end up with a trainer who doesn't know what they're doing and causes more harm than good. So there's a huge opportunity here for the right people who are passionate about helping and who are willing to go that extra step and get the education that they need. By 2040, we are looking at a global cancer burden of 27.5 million new cancer cases. And that's on top of the millions of people already living with cancer. So we have new ways of treatment that are constantly being updated and changed and improved. So survivorship is much higher, but unfortunately, we are not seeing cancer cases go down. Now, in the United States, we saw a pretty large decline, and it's 2.2%, which doesn't sound like a lot, but when you're looking at millions, so we saw the single largest decline ever recorded, according to the American Cancer Society. And that is a good sign that we're going in the right direction. Hold on, I'm trying to move this cursor around so I can see this. And I can't speak for every place in the world, but I'm sure similar circumstances prevail. And also in the United States, we have a new cancer being diagnosed every 30 seconds, but I have no doubt that it's that way everywhere in the world. And having trained all over the world, it doesn't matter where you live, we are all affected by it one way or the other. But the sad part is that despite the evidence, all of the evidence that shows, that eating right and exercise can help prevent cancer, don't smoke, don't drink a lot, we continue, I don't mean we, the fitness professionals, but people in general continue to have these bad habits. And somebody posted something on Facebook, during the pandemic and said 80% of gym members won't even know they closed, because even those people who have gym memberships don't go to the gym, they don't use it. So let's start off talking about prevention. Now you have an opportunity to build a community. And one of the things that we incorporate in our training is positioning yourself as the next step in the healthcare continuum and becoming that local expert. But in order to do so, you have to earn the respect of the community, of the medical professionals, and they need to know, like, and trust you. So by building a community and by getting out there and, whether it be through a Facebook group or you're speaking at a hospital or a cancer center, you are giving information, you are educating, you are building that trust and that respect. And so you can start with the general public or people who are at a higher risk for cancer. And it's, there's study after study that shows that exercise can help prevent cancer, specifically with colon cancer, stomach cancer, esophageal cancer, bladder cancer, kidney cancer, colorectal cancer, and breast cancer. So those are the majority of studies. I see you there now, Kat. Good to see you. I wish I could talk with you all back and forth, but I guess that's not happening today. So those are all, points. Just think from a fitness professional standpoint. We know that somebody who has excessive body fat or an undesirable body composition is at risk not only for cancer, but for heart disease, for diabetes, for all types of comorbidities. And so that kind of transcends when we're working with cancer patients into prioritizing what do we need to do first with this client. And that's going to depend on where they're at in the cancer spectrum, if you will, in their journey, and also where they were at beforehand. Was this somebody who was fit previously? Were they deconditioned? What is their age? You have to look at everything. What got them to where they are today? And that's how we can help to change their behavior patterns, not just force them to exercise, but change their behavior. So when people are actually going through cancer treatment, depending on the treatments, the side effects are all over the board. We all hear when somebody has chemo, they lose their hair and they're vomiting all the time and they lose weight. But I don't know if you realize how varied the side effects are from treatment to treatment. So we have systemic treatments like chemotherapy or hormonal therapy, which are seeking to destroy cancer cells throughout the body. And they're not necessarily selective, they can affect healthy tissue as well. And then you have things like radiation, cryosurgery, hyperthermia, which can be more localized treatments. And I say can be because they can also be full body. But when they're localized, the goal is to minimize the damage to the surrounding tissue. And if your client has undergone chemo and they are now going through radiation, they start to overlap. And so the side effects can be even more intense. Study after study after study has shown that people who begin an exercise program or continue exercising during their cancer treatment are going to be better mentally and physically. It can reduce nausea and increase appetite. We have cancer cachexia. It looks like cachexia, and that is muscle wasting. Oftentimes people have no appetite. They might have a metallic taste in their mouth. They might have sores in their mouth. It could be painful to swallow. There's any number of things that can go into this. And so anything that we can do, for example, if exercise can increase their appetite, then hopefully we can start to help people build some lean muscle and, reduce the amount of adipose tissue. When men are going through hormonal therapy and they are blocking or stopping the production of testosterone, it is going to be very difficult for them to build lean muscle. It doesn't mean they won't at all, but they get gynecomastia and breast tenderness and growth and lose their lean muscle mass. So imagine, and I'm just using a man as an example, but imagine the loss of self-esteem, the loss of self-confidence, and maybe increased depression that goes along with that. Cancer can strip you of everything. And, whether you're diagnosed at 18 and barely know what cancer is, or whether you're 45 or 70, when you hear you have cancer, your life is forever changed. And it could be better than ever. Some people use it as an opportunity to change their life and have better habits and better mental outlook and all those things. But cancer can strip you of everything, from your hair to your muscles, to your health, to your finances, your relationships, your finances. And as a cancer exercise specialist, we have the ability to help people take control of their minds and their bodies when they feel that they don't have any. And that is crucial. And I know that those of you out there who've gone through this yourself can completely relate that this goes beyond just the physical. One of the most important things is that exercise can help decrease pain, and pain might be caused from the treatment. It could be caused by the surgery itself, could be from a tumor pressing on a nerve. And so doing the right amount of exercise and understanding that perfect equation can set that person up for much better performance. And even, it could be muscle pain too. It could be delayed onset muscle soreness. If you do too much and that causes an increase in pain, that person is probably not going to want to keep coming back. So it's really this finessing the workout, figuring out what this person needs right now, because their needs while they're undergoing treatment may be completely different than when you work with somebody who's 2 years out, or even 2 months out. We have to be able to kind of periodize what the workout programming looks like, and you have to understand all of the questions to ask and all the information you need in order to do so. Improve sleep, huge. Your body has to have that downtime in order to heal. And remember, it's not just the cancer cells that are affected. Healthy cells can be affected too. And your body needs the rest, and it's using its energy to heal itself. So getting 8 hours of sleep, there's 4 pillars really that I see as far as a strong immune system: sleep, managing stress, exercise, and diet. And without those 4, we've talked a lot about immunocompromisation with COVID. And when we're dealing with cancer patients, many of them are immunocompromised. So just having them exercise is not enough. You have to have the 4 pillars, whether you're responsible for all of them or you're referring them out to other experts. And all of this is going to give people more energy. 76% of cancer patients report extreme fatigue. So exercise will help them to feel better. It'll give them more energy. But if you do too much too fast, it can have the reverse effect. And so that if your client or patient leaves feeling more fatigued than when they came to you, you've done too much. And that's just one example. And so it's really important that you start and progress slowly. And regardless of where that person was prior to coming to you, prior to their cancer, we're starting at the beginning. We're starting at ground zero. And people will go at their own speed. Some people might make gains a lot faster than others, but their body will dictate how quickly you can progress. And overall, people should feel better about their life in general. Again, it's kind of, it's something that they have control over when cancer has taken away a lot of decision-making abilities for the individual. All right, so they're done with treatment, and granted, we can be working on range of motion and posture and all these things during treatment, but after treatment ends, that's where we can really see improvements, because now the body can devote everything to just rebuilding itself. And oftentimes we will see clients with limited range of motion. Now, most often this is going to be after breast surgery, mastectomy, breast reconstruction, radiation to any part of the body, or in head and neck cancers, there could be a combination of radiation and then removal of a particular muscle. All of these things can cause limited range of motion and muscle imbalances. So we need to be able to identify these and do a comprehensive postural assessment. Use a goniometer to measure shoulder range of motion when needed. It's not always going to be an issue. And to be able to determine the source of the issue, not the site. So for example, somebody might be excessively lordotic, but until you do the modified Thomas test and rule out tight hip flexors, weak glutes, we can't say that it's not weak abs, tight lower back muscles, or weak abs and tight and weak lower back muscles. We've got to do the entire assessment and incorporate a squat test, a gait, or movement analysis. All of these things help to individualize it. So I'd love to hear from you guys and know, what do you do? Are you a personal trainer? Are you a yoga instructor, Pilates instructor, physio? Because everybody's got, their own arsenal, if you will, of exercises or rehab interventions. And depending on who you are and what you're doing, there's a certain place along that spectrum. So the personal trainer needs to know, hey, this person can only raise their arm up to shoulder height. They probably have a frozen shoulder. I need to send them to physical therapy. And then the physical therapist, once insurance is done paying or they've reached a certain, level, they need a qualified cancer exercise specialist that they can collaborate with and transition that patient from a rehab to a post-rehab setting. So working together is great. It also creates that relationship that you want to build with the medical professionals, because ultimately we want to receive medical referrals, right? So we have to earn their trust. This is a lot of information that I'm going to condense, into this hour, and we spend 20, 25 hours going through this during the course. So I don't mean to leave you hanging, wanting more, or do I? Then you can come do the course, but it's a lot to take in. So I see some questions popping up, and like I said, I'm going to save them to the end because I am super ADD and I will get lost and not find my way back to the PowerPoint. All right, prevent or manage lymphedema. I am going to throw this out there, and Frank and Kat, anybody who's taken the course cannot answer this, okay? What is lymphedema? I know, Kat, you're chomping at the bit. I really want to answer it. I really want to answer it. If nobody answers it soon, then you guys can. Anybody have an idea what lymphedema is? Da, 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 da. All right, we'll give them 10 more seconds, Kat, and then you can answer it. And if you can make it on your chat that everybody can see the responses, that would be awesome. So go ahead, Kat, tell us what it is. Actually, I wonder if I can unmute you. I think I can. Here we go, Kat, I'm gonna let you talk. Okay, let's hear it. Okay, hold on, because I can't hear you. I don't know if anybody else can. Can anybody else hear Kat? Because otherwise, this isn't gonna work. Okay, nobody can hear you. Try again, real quick. Okay, well, here, you do that. I'll ask you another question. But in the meantime, lymphedema is the swelling of the particular extremity, typically, but it can be any place in the body that has had lymph nodes removed or irradiated, okay? And so you have to know these questions to ask. And that's the thing, like a lot of people who start working with cancer patients, you have no idea. You don't know to ask this. So if they've had lymph nodes removed, from here up, they're at risk for upper extremity lymphedema. And then if it's from here down, they're at risk for lower extremity lymphedema. And I'm oversimplifying it. But we have to incorporate lymphatic drainage exercises to open up these restricted pathways It's kind of like a traffic jam on a freeway. Okay, so let's say you're on I-5 and you're, going up and down California coast, and there's 5 lanes of traffic, and every morning at rush hour there's 2 million cars that go from point A to point B in these 5 lanes of traffic. Well, what if we shut down 3 of those lanes of traffic? We still have the same 2 million cars, and now we've got that bottleneck. And that's what can happen with lymphedema. The problem is it's really kind of an enigma. It affects some people and doesn't affect others. It can happen anytime after treatment. A day later or 30 years, the risk doesn't increase or decrease with time, although they have kind of narrowed it down to the peak is at about 2 years when scar tissue and adhesions, have really formed. And so breaking up the scar tissue and adhesions through a specialist who can do that, a certified lymphatic therapist or massage therapist who works with oncology patients, can actually help to prevent lymphedema. So, and so can we in the exercise world. We know we need to increase lean muscle mass, which is going to burn more calories. It's going to help, negate some of that muscle wasting, and losing fat will help prevent many comorbidities. And it's going to help people get back to their activities of daily living, the things that give people joy. And unfortunately, when you're going through treatment, most people aren't able to play golf, play tennis, go to the gym. Some do, by all means, but usually your life is affected for a while. Exercise will help increase self-esteem and self-confidence. It kind of, gives you that, yes, I can do it, even if it's in baby steps. And most cancer patients know that this is going to be a process. You're not going to just get back like that. But you will have people who are athletes or were athletes that want to go faster than they should. And that's where we have to know how to pace them and how to get into their psyche, come up with alternatives to keep them feeling good about themselves, and at the same time prevent some of these issues like lymphedema, which is entirely preventable with the proper exercise programming. We're going to give people more energy, and that will help negate some of the fatigue. And fatigue can be from the treatment. It can also be from low blood cell counts. It could be from recovering from surgery, from not getting enough sleep, not getting the proper nutrients in their diet. And ultimately, this is going to help with just overall satisfaction with their life. Now, long-term side effects. That means these can happen over time. This is not like your hair falling out and it happens right away. When someone has undergone chemotherapy, they will always be at a higher risk for damage to the heart and lungs, osteoporosis, diabetes, and future cancers. Now, we know that we can help to prevent or entirely minimize those risks through proper exercise. We know we've got to do weight-bearing exercise. We know we've got to maintain good body composition and proper diet. And exercise is going to strengthen the heart and lungs. But do you know when to add strength training? Do you know how much cardio someone should do when they're fatigued? I know you do, Kat. She's like, ah! You're the only one that I can see moving around, so you're like right in front of me. And this is what we teach you. You have to understand that when somebody is undergoing treatment and they are low functioning, that their target heart rate is considerably lower than the person who is higher functioning or who has completed treatment. So there are equations that we use for everything. This is so methodical. There is no guesswork here at all whatsoever. All right. Okay. Even children, only 1 in 3 children are physically active every day. Now, when I grew up, we had recess after lunch. You had, I don't know, a half hour or an hour every single day. And now that's like, I don't even know if they have gym class anymore in high school. They've just kind of done away with it. So we had, and it's other things, it's kids, they're on their phones, they're on their Xbox, they're, in chat groups, and they're just getting fat. The obesity level is increasing exponentially. and less than 5% of adults participate in 30 minutes of physical activity each day. So we're only getting 1 in 3 adults is getting the right amount or the recommended amount of physical activity each week. Only 35 to 44% of adults that are 75 years or older are physically active. So let's just focus on that since, we're talking about the aging population. 35 to 44%. This is the time that people need it more than ever. This is the time they start to lose their balance, that their bones become frail, that they are more likely to get cancer and other diseases. Maybe they're afraid to exercise. Maybe they've had bad experiences in the past. Maybe they just hate it. So it's a combination of finding things that they need to do and finding things that they like to do. And when working with pediatric clients like cancer patients, it's really all about having fun and moving. It's not specific, weight-bearing exercises or drills. It's getting people moving, and that is the start. So if we have more than 80% of adults not meeting the guidelines for aerobic and muscle strengthening activities, and adult and adolescents as well, we really have an unhealthy society. And we know that. That's why we're here. That's why we do what we do. The American College of Sports Medicine put out new recommendations last year, and they recommend 75 minutes of high intensity aerobic exercise or 150 minutes of moderate. And they have some standards for weight bearing exercise and all this for cancer patients. But the problem with that is that is a general, that is an umbrella. Oh, I love that, Kat. She just put her CETI approved background. Super cool. That is an umbrella. That doesn't mean that every cancer patient fits into those parameters. There are so many things that we have to take into consideration. And, we go through 4 modules, 500 pages of material and videos and webinars. There's a lot. So, although I'd love for you to take the cancer exercise specialist course, if you're going to work with cancer patients, make sure you have some specific training for 2 reasons. One, the most important is that you can hurt somebody irrevocably, and the other is for your own liability. If you are working with special populations and do not have a substantial, certification or training in that, you are kind of on that, you're teetering on gross negligence. So be aware of that, especially, we're all working with the aging population. And exercise is absolutely medicine. Doctors cannot cure cancer. Doctors cannot cure diabetes. They can cut it out. They can give you treatment. They can give you a pill to minimize the side effects, but they can't cure it. What can cure it is proper diet, stress management, and exercise, reducing inflammation and infection, and taking that body out of the diseased state. So what are some ways that exercise can be linked to reduce risks of cancer? Well, for one, it can lower certain hormone levels. So let's start off with estrogen, progesterone, and testosterone. With certain cases of prostate, testicular, cervical, ovarian, and breast cancer, the cancer cells grow in the presence of these hormones. So the hormones act like fuel on the fire. So the first line of defense is to stop or block that hormone, okay? And that's called hormonal ablation. But also, if somebody's, has a high amount of blood sugar, their diet's awful or whatever, and they're producing more insulin. Insulin is then signaling to produce human growth hormone, and that causes cellular growth. And it's not going to be specific to just healthy cells. Cancer cells can grow as well. So obviously, all of these hormones can be somewhat managed through exercise. Certainly insulin can. Helping to prevent obesity and decreasing the harmful effects, especially when people have insulin resistance and they're, on that type 2 diabetes spectrum. Exercise reduces inflammation and ultimately improves immune system function. Now, being that we've all been quarantined and, you know, life as we know it is I don't even know what it is anymore, right? Been more aware of immunocompromisation and protecting ourselves. You know, you have to wash your hands, you have to use antibacterial, you've got to wear a mask, you know, you spray everything you touch. Well, this is the life of the cancer survivor, the cancer patient, okay? My mom has stage 4 breast cancer. She's 2,000 or 3,000 miles away from me, depending on where I'm at on a given day. And she has not left her home for 3 months. She is completely alone. I get manic phone calls one day where she's on the verge of suicide. The next day, you know, she's happy to be alive. She wants me. She doesn't want me. Come get me. Don't get me. And imagine that all of these other people, not just cancer, but anybody with a compromised immune system, how they're feeling right now. They need the exercise and they need that contact with humanity more than ever, but they're isolated. So we have an opportunity now to reach out to people, even if it's virtually, because cancer patients are not going back to the gym anytime soon. Not anybody with an immune system that has been compromised. So in order to help these people, we can make ourselves available, you know, through FaceTime, through Zoom, through, you know, webinars and all of those things. And trust me when I tell you this is a market or group of people. You know, first you've got the baby boomers, you've got that aging population, and this is a subdivision of that. They want your help. They want to feel better. They want to live longer. You can be like a concierge and you can coach them. You can't, unless you're a nutritionist or dietitian, you can't give dietary advice, but you can certainly keep them accountable. You can help them, you know, make grocery lists. You can make sure they're eating their meals and not skipping meals. You can make sure they're getting enough sleep. And this creates more of a need for you. This is how you build that relationship. And this is what keeps you from being disposable. Okay, as you build this relationship with somebody, it's not so much that they depend on you. I mean, they do to some extent, but you have this relationship. They see value in you. So the more that we can offer and the better results we get through having somebody, you know, feel better, the longer they're going to be clients, and that's where you're going to get your referrals. When that client goes to the doctor and says, oh my God, I can move my arm, my back doesn't hurt, Andrea is the best thing since sliced bread, then the doctor's like, really, do you have her card? So on and so forth. Oftentimes people have issues with their bowel movements, and when the food or the waste stays in contact with the mucosal lining of the stomach for long periods of time, it can become, potentially become carcinogenic. So exercise will help move things through the colon and eliminate waste. Lifestyle ultimately results in the outcome of our life, of our health. There is a huge need, which represents a tremendous opportunity for us as health and fitness professionals. And some of you may be in the medical side of things, and that's great too. I mean, we've had patient navigators, oncology nurses, massage therapists, PTs, OTs, that have all adapted the information in the course, you know, for their use. Everybody has different modalities, but 50% of doctors don't know how to prescribe specific exercises for recovery. And that number probably is higher because that's not in their scope of practice. Just like my scope of practice is not to cut somebody open on an operating table. I have no idea what I'm doing. They want to be able to refer to somebody that they know, like, and trust, and that will take good care of their patients because they know they need it, but they don't necessarily know who to refer to. In certain places, there are cancer centers, you know, your big clinics at, you know, Vanderbilt, Sloan Kettering, Mayo Clinic, Fred Hutch, all these places. And therefore, that would be more of the rehab or the clinical setting. But then they get out of that and they don't know where to go. And a lot of people do not want to exercise in a clinical setting. They want to be done. They want out of the hospital. They want out of, you know, where they had their chemo, their radiation. So another opportunity, whether it be in a club, in a studio, in their home, or virtually, for you to reach out. Let's see how I'm doing on time here. I want to make sure I leave enough time for questions. So different components of the exercise program. One of course is flexibility and range of motion, and that is our first priority. We do not want to add a load to a limb in a plane of motion that has limited range of motion. So we need to help them with specific exercises to get their range of motion back. That's going to help them perform activities of daily living. It's also going to increase lymphatic flow and drainage. Now, I'm going to use breast cancer because it's easy to imagine. Here are the pecs, let's say. Okay, here we go. Okay, and when somebody has a mastectomy and, you know, the breast tissue is removed and these scars, these incisions heal and the scars, you know, tighten up, then maybe they have radiation or maybe they have reconstruction. What happens is these muscles can be in a constant state of spasm. And you'll hear people say that, you know, my chest is just always tight, or I have a lot of pain in my chest, or I feel like I have lightning bolts going through my chest. And that can be because the blood flow is decreased through ischemia. You're not getting that blood supply to the area, and so you're not getting the oxygenated blood. One of the easiest ways to remedy that is to stretch those muscles and then choose the opposing muscle groups that we need to strengthen to maintain that. Because if we just stretch, but we don't strengthen the opposing muscle groups, it's going to go right back. I mean, it's kind of like scar tissue memory, like muscle memory. So you must continue, even once you do incorporate strength training, to continue with the range of motion and the stretching, or at least assessing it every couple months. This is also going to help improve posture and ultimately improve performance. And when we look at specific planes of motion, you know, what do you need to do to throw a ball? You need to be able to externally rotate. What do you need to do to play tennis? You need to be able to internally rotate, or you can analyze it based on what their sport is. And the information that you learn that you can work with cancer patients can also be applied to anybody. I mean, children, athletes, adolescents, you name it. But what you need to know is, when is it appropriate to incorporate weights or resistance or hold a yoga pose for an extended period of time? At what point is it too much? There's definitely a too much. And what are the limiting factors? It could be pain, could be fear, could be scar tissue, could be adhesions. And this is something that we take you through week by week and day by day, to help you piece these things together like a puzzle. It's actually like putting together a mathematical equation. So although I'd like to give you all of these answers, I'd need you to stay with me for another 20 hours. All right, we want to incorporate meditation, relaxation, yoga. I mean, whatever form of this you want to do. It's going to help them relax and manage their stress. It will help decrease depression and reduce anxiety. What happens when you have anxiety? You tense up, right? And so if you already have tight muscles and ischemia, that's only going to make it worse. And people also do what's called guarding, you know, which is a flexor response, and that also tightens up the muscles. So anything we can do to calm their body and their mind, it will help decrease pain. It will improve performance, and like all of the other exercises, will burn calories. You know, the amount obviously varies. But when do you do this? When is it too much, or is it? I can tell you right now that if somebody doesn't have adequate range of motion, and I say adequate because we actually have norms that we go by. If they do not have adequate range of motion, even a gentle yoga class could be too much too soon. So you need to understand what modifications to do in your Pilates class, in your yoga class, even in your physical therapy clinic, because you might be a DPT, but if you don't know the specifics about cancer, everything you know about rehab is inconsequential, because you have to put it all together and know how to modify it. Swimming is amazing. It will help people to increase range of motion after surgery and radiation. It's great for arthritis, especially if the water's warm. And because of the hydrostatic pressure, it can help prevent or minimize lymphedema and the swelling of the limb. Now, in circumstances where the pool is not on the warmer side, it will keep people cool during the workout. That can also help minimize lymphedema, because as the body heats up, it increases the circulation and also the flow of lymph. Swimming is going to strengthen their heart, also increase strength, and burn calories, and it has no impact. So you might have somebody, who can't walk on a treadmill. Maybe they have peripheral neuropathy, but they could walk in a pool, or, put on the belt and jog in the pool. Pool is awesome, but you need to know when it's appropriate, because if somebody has a compromised immune system, they should not be swimming in a pool, in a lake, in a river, in the ocean. So you need to know their blood counts. You need to know if it's okay for them to go in a pool. And if they have a skin irritation from hyperthermia or from radiation, probably not good for them to be in a chlorinated pool. If it was just salt water, it would probably be fine. But anytime the immune system's compromised, we do not want to take a chance, with all of the potential bacteria. Cardio is going to help decrease fatigue and, of course, increase energy, strengthen the heart and lungs, and it will also burn calories and improve quality of life. Because, in terms of activities of daily living, well, we all walk from point A to point B. I mean, most of us do. So what's the best way to become better at walking? Walk. Now, should everybody be on a treadmill? Absolutely not. What if they have peripheral neuropathy? Or they have poor balance? What if they have neurological issues or brain metastasis, and their gait's off? Do we want them on a treadmill? No. If they have multiple myeloma with lytic lesions, or if they have bone fractures from bone mets, do we want them on a treadmill or a bicycle or roller skates or downhill skis? Absolutely not. So even with balance training, you need to know how to progress and sometimes regress accordingly. So we're going to start by somebody standing on one foot holding on to something. And if they can do that, no problem. Then we do 1 foot not holding on. Then if we can do that, then we go to like the AirX, whatever they call the pads, with a little balance challenge, and they hold on. And then if they can do that well, then we go without holding on. And then maybe we go to a BOSU balance trainer. But maybe we never go to a BOSU balance trainer because the risk is too high for that person to fall off and fracture something, really hurt themselves. So there are a lot of different things that you have to consider when you're putting together this exercise program. It is not your normal exercise program for your normal, healthy, robust client. Strength training is going to help increase bone density and reduce the risk of osteoporosis. And whether it be somebody's menopausal, whether it be that they've gone through chemotherapy or they are on corticosteroids, they are all going to be at a higher risk of osteoporosis. And that can be exponential if they have multiple factors, in which case that just tells you, in the hour or the half hour that I have to work with this person today, what is the most important thing we need to do? Maybe completely different than what we're doing 2 months from now or even next week, but what do we need to do today? We know strength training is going to help with body composition and building lean muscle mass. And that, of course, will burn more calories. They're going to have an improved quality of life, increased self-confidence. It might just be having the strength to open up a medicine bottle, right? Increased strength and also improved ability to perform activities of daily living. But you need to know when to start. And again, do they have adequate range of motion? Are they at risk for lymphedema? When is it too much? How do you progress? Do you go from 1 pound to 5 pounds to 10 pounds? No, you have to go from 1 to 2 to 3 to 4 to 5 to 6 to 7, so on and so forth, or yellow to green to red. Because if we do too much too fast and they blow up with lymphedema, swelling, or they have some other negative side effect, we got to go all the way back because we don't know. We took such a big leap that, if we went incrementally, we could just go back to like the last given weight or the last day we worked out. So better to go like a turtle, just slow and progressive. If somebody has neuropathy, let's take the woman on top and she's holding that band. If she has limited sensation in her fingers and doesn't have the ability, for fine motor skills, she might let go of that and it could snap and hurt her. It could snap and hurt the trainer. Or same thing with the guy holding the weights. If he had neuropathy in his hands, he could drop the weight and break his toes. So you really need to think about that. Or if they have peripheral neuropathy in their feet, you're going to want to avoid all high impact activities. and anything, you know, you got to be really careful with balance. Working on balance and core, especially with this aging population, is critical. It's going to decrease the risk of falling and prevent injuries. Also, it's going to reduce back pain, increase strength, and help them perform activities of daily living. But can the person who has bone mets in T12 and has a collapsed disc be doing this position? Or is that putting them at risk because they don't have that core strength to support themselves? You need to understand physiologically what's going on based on the surgery and the treatment so that you know what exercises this person can do. Can a person who's undergone a mastectomy and has expanders in place do a plank? Absolutely not. And while the expanders are in place, they should not do any chest or back work. So this is just one of many things that you must know before you start working with cancer patients. And so you might ask yourself, or I'm asking myself, why does mainstream exercise programming fail when it comes to cancer patients? One, it doesn't take into account acute and chronic side effects. So yes, like I said, they have hair loss, they have short-term memory loss, chemo brain, which can actually last for years, forever. Fatigue, which can last for years. All these things, some of which, you know, you lose your hair, it grows back. Your nails are brittle and break, they grow back. You have vomiting and diarrhea, that eventually ends. But nobody's looking at the long term, the risk for developing osteoporosis, diabetes, heart damage, and future cancers. All of those things need to be considered because the exercise programs should be structured to prevent or minimize them. And you have to take into account muscle wasting and severe fatigue, hormone-related weight gain that's very difficult to lose, you know, and setting realistic goals with clients, knowing that if they have vomiting or diarrhea, they shouldn't work out for 24 to 36 hours, that they need to rehydrate, they need to replenish the electrolytes. And then figuring out, you know, in correlation with their treatment days, what is the optimal training schedule? When are they going to feel best? So you're going to consider age and previous fitness level, the comprehensive assessment, the surgery dates, where the incision or incisions are, if they had an amputation. And we're not just talking an arm or a leg. It could be a breast. It could be the sternocleidoid mastoid muscle. It could be the rectus abdominis, the latissimus muscle in a muscle flap. And then you want to know the treatment dates and if they're undergoing treatment or if it ended, and incorporate the acute and chronic side effects, and whether or not they have a port which is implanted and they can do blood draws or give chemotherapy. But for them, they can go into a swimming pool, where if somebody has a PICC line or an external line, they should not be in a pool. So there are all these different things that you need to consider. And then of course, adding to it the comorbidities. So ask yourself when you're putting together a workout what the purpose is, weigh the risks and the rewards, and look at the specificity. And then ask yourself how relevant at any given time a certain exercise is and if it's appropriate for that person. That's kind of like your own checklist. And remember that especially now, and with coronavirus not going away anytime soon, we have cancer patients that are scared. They're scared of dying. My mom's scared to death. If she wasn't scared of cancer, she's scared to death of coronavirus. They're isolated and they are lonely and they need us. So I pretty much already said this with the Concierge Fitness. You could put together a monthly program. It doesn't have to be hour by hour. You know, I'm going to meet with you 2 times a week for a half hour. I'm going to have 3 phone calls with you just to check in and, you know, A, B, C, D, and have like a menu of services that you can do. And, you know, obviously choose the services that you should be doing versus, you know, like I'm not going to do nutrition because I'm not a nutritionist. And there are certain contraindications with herbal supplements and certain foods that with chemotherapy and other treatments that they can affect the treatment. So please do not work out of scope of practice. Before I get to the questions, I just want to let you know, talked to Dan Ritchie last night, and we are offering a 25% off coupon. And For those of you who already have CES or FAI, I'm happy to honor that coupon for another one of our courses, but you can get the FAI CES combo or the CES combo alone. But to be honest, the coupon code I'm going to give you is going to work for any of our courses. And that's CETI's courses. So that's going to be the Cancer Exercise Specialist, Breast Cancer Recovery, BOSU Specialist, CETI University, CES Pilates. So if it's a partner course other than FAI, the coupon won't work. And so you just go to ceti.teachable.com, use all caps June FAI, and make sure you do it before June 30th. And would love to have you as part of this growing network of professionals around the world. And now I am going to look back and try and see if there's any questions here. So April, you manage a medical fitness center and would like to cater to cancer recovery patients. I'd be happy to speak to you. Oh, I guess I have to put the slide up. I just deleted the slide presentation. Hold on, can I share it again? Hold on. I'm not good at doing this on my own. Let's do share. Trying, there we go. And I think there's another page with my contact information on it. Okay, perfect. So there's all my contact information, and real easy to remember. That's a long email, but you can email me at ceti.guru, or no, CETI Guru. Here, let me just write it. So many flipping emails. CETIGuru@gmail.com. So feel free to reach out to me. Happy to talk to you, April, or anybody else. Thank you. Kat and Frank have both gone through the course, and super thrilled to have them on board. Kat's in Florida. Frank is in Virginia Beach. Yes, Kat mentioned scar tissue is not addressed enough in medical settings. And we actually have part of the course, there is a video webinar by Denise Stewart, who is a scar tissue specialist. She's in Australia, and she does a wonderful job with that. Thank you, Sandy. Appreciate the kudos as well. I'm so glad to have you as part of the team. Elena, hey, baby. I'm going to see her. I'm driving down to California. Who else do we got here? Tammy, I said expanders. So after they remove the breast, they, in certain cases, will try and stretch that tissue so that they can then put an implant there. So they stretch the skin first, then they swap out the expanders for implants. But while the expanders in, absolutely no chest exercise, and that also means no back exercise because of reciprocal inhibition. So Eric, as far as assessment protocol, we are in the university, so we have a 5-week university also, as well as the home study, and Kat just got out of that, and Sandy. And we actually teach you how to do the assessments online, and it's challenging, but you can do it. And then you have apps like Posture Screen. I personally like to do it myself, and I find it fascinating, the science behind it. And as far as like goniometric measurements, needless to say, we have to be in person, but we can certainly eyeball it and notice if there's a huge difference between, you know, the left and the right side. Okay, so Kat, when you come back to Denver, let me know. And I don't know who Cutting Edge Fitness is by that title. So who are you in real life? Okay, anybody else have any questions? I'm happy to unmute you if anybody wants to talk. Elena is another cancer exercise specialist, and Elena is going to be coming back with me from California and she's going to be our model in the upcoming books. So now I see Miss Cutting Edge Fitness. Hi. It's so great. You know, we really are like a great big family. After you get done with the training, we have mastermind groups. We have our private Facebook group on Just Cancer Exercise Specialists Facebook group. And we share ideas, we share case studies. You know, I constantly want you guys to be educated. And the information, we update our books every 2 years. And so you guys have to get the new materials and retest, and that ensures your competency so that people know that CETI cancer exercise specialists have the highest level and the most current training available. Okay, Marilyn, as someone who has not had cancer, would you suggest shadowing in a medical facility to gain perspective? You can, and also in our cancer exercise specialist group, we have people that will be your mentors, but you not having cancer doesn't matter. I mean, having cancer kind of throws you into the fire, but certainly does not mean that that's a prerequisite. You know, most people who are drawn to this have a passion for it because either they or somebody they love has had cancer and they've seen them suffer and what have you. But it's a great career choice. It is the most rewarding thing I have ever done. And I could certainly, you know, have continued to work with healthy people, non-cancer patients, but this has been absolutely the most rewarding thing I've done in my life. Okay, well, if you guys do not have any questions, we're just a couple minutes early. I'll see if anything else pops up, but otherwise, thank you so much for being here. Great to see some of your faces that I can see here. Thank you, Terry, appreciate that. Yeah, there's so much more information, and even if you've done like the Live Strong, it's a great foundation, but people who come to me after Live Strong say, oh my God, I had no idea what I didn't know. ACSM is great, but it's very clinical, where we are more about individualizing it and, you know, one-on-one, and their materials have not been updated for 10 years. But, you know, you might need to do ACSM, and so that's great. I don't care. Get training, know what you're doing before you get out there and cause somebody harm or, you know, end up in a pickle yourself. Thank you for being here, Krista, Terry, Marlon, everybody. Really appreciate it. Thank you guys for the accolades, and enjoy the rest of the summit. It looks like, despite the virtualness of it, they've got a really good turnout. So take care, and would love to see you guys in one of our future trainings. Bye.